I'm Dr. Deon Weyers, a board-certified plastic and reconstructive surgeon with a private practice at Fourways Life Hospital, Sandton, Johannesburg. My passion for cosmetic procedures led me to obtain additional experience in VASA lipo training, and I'm a key opinion leader in non- and minimal invasive treatments such as neurotoxin injections. In 2020, Jackie Swart, the head of research and development at Nimue Laboratories, approached me to assist with the testing of a new skin rehabilitation range with the aim of supporting medical aesthetic treatments and plastic surgery procedures. In order to complement the work done in medical practices, the new MD range took the phases of wound healing into consideration. The 4 stages of wound healing overlap to varying degrees in different individuals. The target is specific mechanisms in each phase to support the repair and regeneration and control the inflammation and collagen deposition. Wound healing, as a normal biological process in the human body, is achieved through 4 precisely and highly programmed phases: hemostasis, inflammation, proliferation, and remodeling. For a wound to heal successfully, all 4 phases must occur in the proper sequence and time frame. There are many factors that can affect wound healing which interfere with one or more phases in this process, thus causing improper or impaired tissue repair. Firstly, the hemostasis stage. The easiest way to recognize your body has started the hemostasis stage is that the blood will begin to clot. Platelets then stick together to seal the break in the skin. After this, your blood will begin to coagulate and threads of fibrin, a protein in blood plasma, will bind the wound closed to stop the bleeding. Secondly, the inflammatory stage. The second stage, the inflammatory stage, occurs right when the skin breaks as well. When injured blood vessels begin to leak, swelling occurs. The swelling and inflammation help control the bleed and prevent infection. White blood cells, called neutrophils, enter the wound to remove bacteria and debris. The neutrophils also release proteins and growth factors to help with the repair. During the inflammatory stage, people usually experience swelling, redness, and pain in the area. 3. The proliferative stage. The third stage, called the proliferative phase, is when the wound rebuilds itself and new skin grows over the area. The wound begins to contract as new skin tissues are built. More blood vessels are constructed to give the new tissue oxygen and nutrients. Cells, called new fibroblasts, work to heal the wound by gripping the edges of the wound and pull them together. The new tissue is typically granulation tissue, which is pink and has an uneven texture. The new tissue should not bleed easily and should be light in color. If it is dark, this can be a sign of infection or poor perfusion. 4th, the final stage is the maturation or remodeling stage. This final stage is when the collagen in the skin is remodeled and the wound completely closes. In the previous stage, the proliferative stage, the collagen that rebuilds the skin is uneven and thick. As the maturation stage occurs, the collagen fibers begin to align with each other and lie closer together to cross-link. Cross-linking makes the skin resilient and strong. In terms of medical intervention, to decelerate the aging process, there are numerous treatments and procedures. Non-surgical procedures include neuromodulation, like Botox, volumization, like fillers, repositioning, the non-invasive techniques of Thera, but also less invasive Accutite, FaceTite, or threads. Biomodulation using PRP, PRPM, stem cells and other biologicals, and also the resurfacing procedures using lasers, IPL, invasive or non-invasive radiofrequency, and chemical peels, and then lastly, vein treatments. Plastic surgery applications include face and head procedures such as facelifts and rhinoplasty, breast procedures and body contouring procedures such as liposuction. Key to these medical interventions is topical products that offer the following: support or control trauma to the skin in your peels, your devices, lasers, needling, injectables, surgery, wounds, burn wounds. Secondly, improve the outcomes of the instrument-based trauma created. Thirdly, support reepithelialization. 4th, accelerate healing. 5th, control the inflammation. 6th, decrease the downtime. And ultimately, 7th, to have enhanced results. This is the exact gap that Nimue Laboratories fills with a new compact MD range, as these integrative products have been specifically formulated to rehabilitate skin post-medical aesthetic procedures by controlling inflammation, accelerating healing, decreasing downtime, and enhancing results. The first product tested in practice was the post-procedure recovery balm. Patient 1 came into my practice after suffering a facial and upper body burn wound. I applied a thick layer of the post-procedure recovery balm to the affected area 3 times a day as directed by the protocol. A thick, occlusive balm which soothes and moisturizes, it provided comfort to the patient. As the course of the treatment progressed, we can see a visible improvement in the healing process of the skin. And by day 7, the damaged tissue had been removed, peeled off, revealing undamaged skin tissue underneath. In a burn like this, you would expect to see damaged tissue beneath the affected tissue. However, the balm accelerated healing and epithelialization to promote skin recovery. Patient 2 was afflicted with burn wounds on their hand following an accident. Because of its location and the fact that a person would wash their hands many times over during the course of the day, the recovery process took slightly longer. By week 4, the hand had completely healed with no visible scarring. As you can see from the images, patient 3 is a young child who was burnt on their face. Even though children generally do heal quicker, burns of this nature may result in long-term scarring. The post-procedure recovery balm was applied consistently, and within 16 weeks, it resulted in complete restoration of the skin. Patient 4 came in for a TCA peel. The post-procedure recovery balm was applied for 6 days post-peel. It relieved the uncomfortable and dry feeling often felt after such a treatment, decreased downtime, accelerated healing, and enhanced results. Patient 5 received a deep chemical peel. The post-procedure recovery balm was applied for 7 days, which kept her skin from feeling tight and dry. The patient also found it incredibly comforting and easy to apply. Patient 6 is a 2-year-old who suffered a burn on her chest. After 5 days, the wound was completely healed. The second product assessed at the practice was the anti-inflammatory serum. Patient 7 came in for microneedling pen treatment, which does result in inflammation and redness. Even though the anti-inflammatory serum decreases the heat and erythema, it does not slow down on the remodeling and the restructuring mechanisms that we are achieving from the treatment. Over the 12 weeks of use, it takes away the discomfort and soothes the skin. Patient 8 also used the anti-inflammatory post-microneedling pen treatment. After 6 weeks, there is a very noticeable decrease in inflammation and redness. As with the 2 previous patients, patient 9 used anti-inflammatory serum after a microneedling pen treatment. After 4 weeks, her skin had recovered completely. The third product assessed was the scar gel. Patient 10 was bitten by a spider, which left a gaping wound. Once the wound had closed, the patient consistently used scar gel for 5 months, resulting in reduced scarring and post-inflammatory hyperpigmentation. Patient 11 used a combination of scar gel and microneedling over the course of a year to assist with an existing scar. The scar reduced in size and also reduced post-inflammatory hyperpigmentation. Patient 12, a 73-year-old woman, used the post-procedure recovery balm and scar gel on a wound on her hand. The post-procedure recovery balm was used for 3 weeks, while the scar gel was used for 6, resulting in the scar being hardly noticeable after only 9 weeks. Post-operation, patient 13 used the post-procedure recovery balm and scar gel. Within 14 days, the wound had completely healed and the scar had improved drastically. The last product is the replenishing rescue cream. Patient 14 suffers from eczema flare-ups. The rich replenishing rescue cream was used over 3 months to help control her very dry and flaky skin and compromised skin barrier. It provided the skin comfort, relief, and nourishment. Incorporating the MD range from Nimue Laboratories in your practice can be a great way to complement the treatments you offer. By providing patients with high-quality skincare products, you can help them achieve optimal results post-treatment, prolong the effects of the treatment, and improve their overall skin health. When selecting a skincare range, it is important to choose products that are backed up by science and contain key ingredients to support the specific needs of your patients. Additionally, providing education and guidance on the proper use of the product can help patients achieve best results and increase their satisfaction with your practice.